At first glance, Guatemala doesn't look like a third world country. Signs along the way remind us of home, but we soon find this is only a facade and come face to face with children and adults in desperate need.
Those of you who are on your first mission are in for a really unique experience.
Plastic surgeons Manny, Pena and Joe Mazza, along with anesthesiologist Bob Turner and orthodontist John Richards, will perform life-changing surgery along with a full medical team of nurses and technicians, here to mold new smiles from horribly deformed ones. And only 1 hour earlier at the airport, we all wondered whether the mission was doomed from the get-go.
The IV sets, the IV needles.
You can buy that from here.
And it's my clothes.
Well, we all made it here, but we're missing one of the anesthesia bags. So if we don't have an anesthesia bag, we don't operate.
Spanish breathing circuits, do you have the pediatric breathing circuits?
Then hope arrived.
Thank you very much.
It was a pleasure.
Oh, it's an honor. Thank you.
A local anesthesiologist heard about the mission and had decided to meet us at the airport in case we needed anything.
He said that if we lost our equipment, he can probably help us out getting it back.
An unexpected stroke of luck we all hope holds as we leave the city behind and wind our way to the northwest, stopping over in Antigua for a quick night's sleep. We wake at dawn to church bells ringing in the day and board our school bus once again. The final destination, Huehuetenango, a tiny village that takes us more than a day and a half into steep but breathtaking countryside. Once there, we unpack equipment for surgery and examine patients who hope these docs can heal their smiles.
Coffee.
For the baby?
Yeah.
Oh, yeah, it's very common.
Yeah, it's
Especially with a little bit of sugar and a little bit of milk.
The deformities are more severe. The children are more malnourished and much smaller than what we normally get.
Then, in the midst of examining children whose lives they hope they will change, the nurses who are setting up the operating room are unexpectedly called into action.
And it was real obvious that his leg was missing and this arm here was hanging off, so we asked them if, they needed any help.
A huge boulder all but killed him, and with only 2 doctors to stop the bleeding, he probably would have died. But our nurses step in and the surgical team triples. Meanwhile, the rest of our team makes tough choices, deciding who gets surgery and who doesn't. This father finds out his baby is too thin and fragile. Sadly, he didn't know his infant girl needs more than a diet of coffee to thrive. And while malnourishment runs rampant in Huehuetenango, hope is here. And this 17-year-old mother and her baby personify it. Our team decides to operate on both, even though the cases carry a load of risk.
Local anesthesia?
Could do local, straight local.
Straight local on the mother because she's pregnant?
That means this teen mother will be awake while doctors pound out a new smile. But that's not the only kink to iron out. Tomorrow, find out how doctors do something they've never done before. The beauty of Guatemala is almost overpowering. So is the poverty, and the downtrodden of this country suffer the ravages of not having enough. Many mothers don't get prenatal care, reflected in the faces of their children born with cleft palates. 17-year-old Francisca and her 17-month-old baby both have the defect, but not for long.
It's going to change her life.
Still, 2 massive roadblocks stand in the way.
Straight local on the mother because she's pregnant?
Francisca is expecting, so she can't be put under anesthetics during the operation. She'll only get a little deadening to ease the pain of the scalpel.
She doesn't speak Spanish very well.
Okay.
He knows.
Even though Dr. Pena speaks Spanish, Francisca only understands an ancient Mayan dialect. With no way to communicate, if she panics, the outcome could be disastrous. Meantime, a lost piece of luggage threatens to scuttle the mission altogether.
I still don't have any breathing circuits and endotracheal tubes, any way to ventilate.
Vital equipment we're hoping a local anesthesiologist could get his hands on.
I just hope and pray that he calls soon and brings that bag, because I'm stuck if he doesn't.
Especially since the equipment they do have is outdated, similar to American hospitals in the 1970s.
And doing kids with no monitors is they can tend to go downhill faster than adults, so a little stressful.
At the 11th hour, the goods arrive and surgery begins. 3 rooms are in operation at once. Plastic surgeons Joe Mazza and Manny Pena work their art with the help of anesthesiologist Bob Turner. And in a third OR, orthodontist John Richards helps the children too malnourished to go under the knife.
The baby's really having a hard time growing and putting on weight.
He's fitting her with a device to close the cleft so food goes into her stomach and not up her nose. Later, Dr. Pena faces the challenging task of operating on a wide-awake, pregnant 17-year-old. To top it off, doctor and patient don't even speak the same language. These risks force him to do something he's never done before: throw out convention and allow Francisca's husband into the OR during surgery.
The only way to do it safely is not using anesthetic, so it's not like I can't just put her to sleep. I have to communicate with her, and the only way for that is with the use of her husband in the operating room.
Everybody holds their breath, and in the end, the plan works. Mom and baby come out fine. A horrible birth defect set straight by the scalpel. But not all surgeries go as planned. When Dr. Joe Mazza first examined this young boy, he knew in the States this child would have 4 separate operations. Mazza decided to do all in one, a call that would test his surgical skills.
Well, he started bleeding, and it started a little bit and more, but it was very tense. We thought we were going to need a transfusion.
But Mazza's expertise pulled the team through, and they anxiously awaited for the boy's dad to see his healed child. At that moment, we all find out. This father won't ever see his son's new face. This father is blind.
You can take care of his eyes.
Oh.
Because he can't see.
I wish I could. Makes you humble and thankful.
Guatemala, a country locals call the land of eternal spring. Huehuetenango is a tiny village in the northwest part of the country where work is hard and pay is low. These men only make about $5 a day. Economic despair robs pregnant mothers of prenatal care, and many of their children suffer with terrible facial deformities, cleft palates. Our group of doctors and nurses operated for days to restore the smiles of dozens of children. Teens who only faced a slight deformity found it erased by the surgeon's artistic hand. Children who might have suffered taunts and jeers from their peers would never know that pain after this operation. Adults who did feel that pain all their lives would now face the world with a whole different outlook. The dramatic changes you see are a testament to years of practice by skilled surgeons who have a simple desire to help. Faces dealt such a hard blow by nature are softened in a way even they may never have thought possible.
Thank you for letting us do this.
The gratitude is overwhelming from a people who suffer hardships we in America can only imagine. But we would come face to face with true poverty as we set out to see the place Francisca and her family call home. Our trip took us high into the mountains through winding, steep terrain. Then the road ends and we set out on foot. We marvel as Francisca carries her baby down rough and tumble paths only a day after both had surgery.
The beauty of this countryside is matched only by its harshness. This is a difficult trek through some very rugged terrain. And not to mention the fact that the air is very thin up here. We're about 7,500 feet above sea level.
Another 45 minutes and a few hundred feet higher, we come face to face with children we're told probably have never seen people the likes of us.
Hello, precious.
They crowd to get a few cheap pens and postcards we've brought from home. Then, after 2 hours uphill, we reach Francisca's home. Her greeting seems standoffish at first. She's shy to show off the new smile. But then, the beauty of surgery brings tears. And we get a tour of their less than modest home. More than a dozen adults and children live in 2 primitive adobe-type buildings. Francisca sleeps on a mattress that lays on a dirt floor. Next door, cooking is done over an open fire. From here, civilization and supplies are a minimum 4-hour trek down and back up. So we thought this would be our last time to see Francisca and her baby. We were wrong.
Oh, look at that palate. It looks good.
2 days later, the team sees their patients for the last time, and the tears well up in all of us. Nobody's immune to the flood of emotion as a sea of faces show their new smiles.
You feel great, and then again you feel sad because you couldn't do all of them. There's still a few to be done, and we're going to come back and finish the rest.
It's a privilege for us to come over here, and they were actually thanking us for doing the work. You know, we want to thank them that we're able to do this.
Then we see a sight none of us expected. Francisca, her baby, and her husband keep their final appointment with the doctors.
I can't believe those people came back. That's the greatest thank you that they could have given us.
Doctors who came to give find themselves on the receiving end of a gift that reveals so many faces of hope.
They may have had cleft lips, but they don't have cleft hearts.
Thanks.
End of a gift that reveals so many faces of hope.
They may have had cleft lips, but they don't have cleft hearts.